Oh, well, good evening. Yesterday, I said, I promise that we will keep you informed of what we are doing and why. I will level with you and I will tell it to you straight, good news or bad. And I also said, let me be very clear, we may still need to lock down and we might need to do it soon. We will do it and we will have no hesitation in doing it very quickly if and when the evidence of infection in our local community shows that it is the right thing to do. Today, as promised, I'm going to level with you. I have bad news. Today, it is the right thing to impose stricter measures on our community and to do so through emergency regulations made today. The regulations will enable the Committee for Health and Social Care to issue directions intended to effectively lock down the community as far as is reasonably possible. This will be for an initial period of 14 days, before the end of which we will have reviewed and decided whether it's necessary to extend that period. Having said that, to prepare ourselves psychologically, I think all islanders should assume that it will be necessary for 28 days. The decision has nothing whatsoever to do with the UK's decision yesterday and is solely to reflect our own situation, which represents a more cautious approach than the UK. I was hoping that we could avoid this, but we always knew it was one possible outcome. And I will be honest that it's come sooner than I imagined, and I can't hide my disappointment at that. I'm going to explain to you what's changed since 11 a.m. yesterday morning. At 9 p.m. last night, I received a phone call to advise that another positive test result had been received. Dr. Brink will provide the relevant details around this case. Suffice to say that subject to the requisite contact tracing, which took place overnight and this morning, by 1 p.m. today, the public health team was able to confirm that this case was one of secondary community transmission. On the back of that advice, the Civil Contingencies Authority was convened for 3 p.m. to take the decision to impose stricter measures on the islands of the bailiwick. At 5 p.m, the Committee for Health and Social Care was convened following the meeting of the Civil Contingencies Authority to provide the directions required to enable enforcement of these new measures. And I'd like to take this opportunity to thank everyone for moving so quickly in response to new information, and their ability to do so is a testament to the forward planning that had preceded today's decision, but in anticipation of it. I said yesterday that we would have no hesitation in moving very quickly, and that is exactly what we have done. When I was first elected to office in 2012, it never entered my head that 8 years later I would be the one signing the regulations imposing the most far-reaching deprivation of personal liberties since the Second World War. And if you had told me that I would be doing so with absolute certainty that it is the right thing to do, and without a moment's hesitation, I would have laughed at you. Frankly, even during the occupation, the island's residents had more personal freedom to move about the islands than will be the case for the time being, which illustrates the scale of the threat to the community and our willingness to take tough decisions quickly. But there is still good news. As you heard yesterday, significant preparations have gone on already. For example, the development of the hot ICU that Heidi referred to. And contrary to rumours that some of you may have heard, I can confirm that we do not have an outbreak in the hospital and we have not had any COVID-19 related deaths. Once again, I would advise strongly against listening to or spreading such rumours. The longer we remain in a lull before any storm that may follow, the more time we have to continue to prepare. And Heidi will, in a moment, provide the initial explanation of what these measures mean. There will be, frankly, many practical questions. We've worked at great speed in the best interests of islanders today, so please bear with us. We won't have the answers to every situation tonight, and more information will be available online this evening in English and 4 other languages, followed by a leaflet drop to all homes over the next day or so. Dr. Brink can provide a more detailed explanation of what happens next in terms of the strategy for the management of this disease, but I'm going to provide a brief overview now. These measures will allow for anyone who is infected but currently not showing symptoms the chance to develop and show those symptoms. Some of these will almost certainly require hospital care. Hence the strategy, which of course is to try and prevent further cases that are likely to push our hospital and healthcare systems beyond our ability to cope, which we've of course spoken about so often in the last 2 weeks. And this approach is also linked to the strategy of test, 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 which, as we said yesterday, will be so much stronger when we have our own test facility up and running in the island. Anyone with any respiratory symptoms whatsoever in the community or hospital, staff members and other groups we consider necessary will be tested. And when we find little evidence of widespread community seeding, then we will be able to lift these measures either permanently or on a temporary basis. I know it's traditional at press conferences for the media to ask the questions, but I'm going to ask the first and an obvious one. Yesterday you said, and I quote, "We've got this." So the question today is, have you still got this? And the answer remains an emphatic yes, we've got this. But today, if there really are any skeptics out there, even they surely have now grasped the importance of everyone doing what we have been saying, namely, you must follow public health advice. Yesterday I spoke about the downsides of locking down the community, not only in terms of the impact on individuals' incomes and businesses, but more importantly on the mental health and well-being of the entire community. Today, we have decided that those downsides are outweighed by the upsides in protecting the community as a whole. And now that that decision has been made, as a natural optimist, let's focus on some of the positives. It may perhaps be an opportunity to spend more time with an immediate family without the pressures of what we used to regard as normal life. It is still okay to smile and laugh, and it may be an opportunity perhaps to read those books and watch that box set that you've been meaning to for a while, or catch up on some paperwork or some jobs around the house. Now may even be the chance to complete your tax return, especially if you're expecting a tax refund. And I, for one, am wondering whether I might finally get to the clear the loft line, which has been on my personal to-do list for 20 years. But in short, today's advice is simple. Stay at home. Stay in regular touch by phone or video call with friends and family. And we will continue to update gov.gg so that you have a reliable source of facts. This decision does not change my other advice from yesterday. Don't panic. Keep calm, stay strong, and maintain good personal hygiene amongst your household. If you start to feel unwell and are symptomatic, follow the public health advice on how to self-isolate from others within your home and call the coronavirus helpline. Rest assured that the whole of government is mobilised to continue to do everything we can to protect you, your families, as well as ours, and we will never compromise or risk that overriding objective. Thank you. Heidi.
Thanks, Gavin. Now, I'm sure many of you watching and listening now will be aware that there have been a number of jurisdictions that have already gone into lockdown. However, that word means different things in different places. As we've always said, the actions we have taken have been guided by the advice from our Director of Public Health, learning from experiences overseas, but at all times considering what is appropriate for the bailiwick of Guernsey. This has meant we have adopted a cautious approach, doing the right thing at the right time, taking into account the fact we're a small community with only one hospital and without the infrastructure of a larger jurisdiction. That has determined our decision to lock down now, and that has informed what we are now asking of you, the people of the bailiwick, over the coming weeks, to help us minimise the impact of the spread of the disease and protect our community from the worst that it could do. We are not doing this because of what the UK did yesterday. So I'll now set out in more detail what the three measures we're bringing in of staying at home, closing non-essential shops and services, and stopping public gatherings mean for you. You should only leave the house for one of four reasons. Shopping for basic necessities, for example, food and medicine, which must be as infrequent as possible. Up to 2 hours exercise a day, to include walking, cycling, running, or sea swimming, or other open sea activities, alone or with members of your household. If sea swimming or open sea activities are undertaken, they may be done with one other person present for safety reasons, provided social distancing is maintained and it is understood that such open sea activities are undertaken at the individual's own risk. Any medical need, if instructed to do so by a healthcare worker or required to do so, having called 999, or to provide care or to help a vulnerable person. Travelling to and from work, but only where this is absolutely cannot be done from home. These 4 reasons are exceptions. Even when doing these activities, you should be minimising time spent outside of the home and ensuring you are 2 metres apart from anyone outside of your household. These measures must be followed by everyone. Separate advice is available for individuals or households who are isolating and for the most vulnerable who need to be shielded. If you work in a critical sector or your child has been identified as vulnerable, you can continue to take your children to school. Where parents do not live in the same household, children under 18 can be moved between their parents' homes. We're ordering certain businesses and other venues to close with immediate effect. These include, but are not limited to, all pubs, clubs, cinemas, restaurants, cafes, and non-essential retail stalls. Also included are libraries, community and youth centres, indoor and outdoor leisure facilities, community places within parks, places of worship, hotels, B&Bs, campsites and boarding houses, except those for permanent residents and key workers. To make sure people are staying at home and apart from each other, we're also stopping all public gatherings of more than 2 people. There are only 2 exceptions to this rule. Where the gathering is of a group of people who live together, this means that a parent can, for example, take their children to the shops if there is no option to leave them at home, or where the gathering is essential for work purposes, but workers should be trying to minimise all meetings and other gatherings in the workplace and should respect social distancing measures. We're also stopping social events, including weddings, baptisms and other religious ceremonies. This will exclude funerals, which can be attended by immediate family. I take no pleasure in telling you this, announcing something that impacts every single person of the bailiwick. It goes against all my instincts as a democratically elected politician who fundamentally believes in the freedom of the individual and whose ancestors fought for that freedom in Flanders and further afield. However, we are facing the most formidable foe that we have seen since the Second World War that has the potential to cause the death of so many in our community before their time. We now have no option other than to take this action. I've been so heartened by the positive way you have responded to the impositions we have already placed on you these last couple of weeks. The next few weeks will be difficult for us all, but by following these measures and supporting each other, every one of us will be contributing to ensuring our community continues to be strong over the months and years ahead. Thank you.
Okay. Thanks, Heidi. So, Nikki.
So thank you. First of all, I'd like to pay tribute to our primary care colleagues. The ability for us to identify this first case of community transmission is directly related to their clinical acumen, and I'm very grateful for that. So the case concerned had no travel history, and that was really important. However, they did have classic features of COVID-19, and this discussion was had with primary care. They discussed it with public health, and our feeling was, in view of the fact that these symptoms were so classic, in the absence of travel history, we should test this person. We tested this person, and they came up positive. They had no travel history in the previous 4 weeks, so it was a clear case of community transmission of the virus. I always said to you I would share the evidence with you. I'd always discuss the evidence, and this was really important for us. So overnight, we learnt about this at 6 o'clock yesterday evening, and overnight we did contact tracing, we looked at the whole case, and we decided there was really something that we had to act on, and act on fast. So on top of that, over the last few weeks, and I think I discussed this with you when we did the school closures, I became aware of clinicians reporting cases of slightly unusual respiratory tract infections. Now, it's flu season at the moment. This could well be flu, it could well be another respiratory virus. But our antennas were up and we were considering whether there was something going on. And this case, when we detected a case of community transmission, we decided that it was time to act. Now, I fully accept that we're acting earlier than other jurisdictions, and we've had one case of documented community transmission, and that many other countries have waited for far longer, and perhaps we've gone up to 6 weeks before, for example, the UK. But I think this is important because we always said to you we would design a program that was right for our community, and the fact that we've got one hospital, one intensive care, one emergency department, and so on. So by bringing in a lockdown and essentially restricting all contacts, what we're hoping to do over the next couple of weeks is really limit any further transmission in the community, and so protect our hospital. So we protect our hospital from becoming overwhelmed. So it's a really containment and flattening that curve, so that we get as few patients as possible in our hospital, and we protect our community as much as we can. So again, this is designing something that's appropriate for our community. We feel it's right. We've gone earlier than other jurisdictions, but we feel it's the right decision for us. And whilst we've made these decisions, we have tried to share every bit of evidence that we have with you, because we feel that it's all of us together. It's Guernsey together that we need to look at where we go as a community. So as we move into what are going to be difficult times, we really appreciate the community's ongoing support and ask them to please understand the reasons why we've chosen to take these very extensive measures.
Okay, thank you very much, Nikki. So we're going to open it up to questions from there. So who'd like to go first? Okay, at the back.
Could I ask, can we have an update on these 21 cases now, isn't it? Could we have an update on their condition? Have any been hospitalised, for instance?
So it's 23 cases,
23, yeah.
including the two from last night. So we're up to 23 cases. We just haven't had a chance to update the website today. So that's the number of cases. And we have no confirmed COVID-19 cases in hospital.
And is there a general update on the condition of the people that aren't in hospital?
They're all doing well. So they get safe and well checks every day, and all of them are doing well. I have to say, some of them have found it to be quite a debilitating illness. So a lot of people have felt incredibly tired, incredibly lethargic, some muscle pains, as well as the classic fever, cough symptoms. And interestingly, other symptoms are coming out, for example, a temporary loss of taste and smell. So we're learning more about this condition all the time. It's a new virus, it's newly entered the human population, and we're constantly learning. Things like runny nose is present in 40% of individuals. So we're starting to learn more about the different clinical symptoms that can occur.
Okay, good. Next question in the middle.
Thank you. Question for Rory, if possible. The relevant authorities, including the police, are being given the power to enforce these rules through fines and dispersing groups and such. Do the police in Guernsey have the power to enforce this now? And if not, when will they?
The position we have here is as a result of the hard work that the Chief Minister mentioned about the legislators bringing forward these regulations, is that the directions are enforceable in law. So unlike the UK, when they announced what they intend to do without the power of enforcement, I think Guernsey has learnt from that, and we have worked incredibly hard today to, when we've made this announcement, that they are enforceable requirements. So bailiwick law enforcement are part of the community. We're in this with the rest of everybody in our jurisdiction. But yes, we have powers to enforce, and we will if we have to, because it's about keeping the whole community safe. And I would just urge people who think, let's try and get round it, let's find a little niche that we may try and exploit. Individuals like that should not do that, because this is about keeping the community safe. It's about, please, not putting additional strains on law enforcement and health services. It's about working collectively as one community. So I sincerely hope we will not be troubled with too much work in the enforcement space, because I know our community will get the seriousness of what we're trying to do.
What does enforcement mean? Is that fines? Is that detention? Can you elaborate on that?
The last thing we want to do is start detaining people. The scale of the offence is a fine, but obviously police officers have various powers. We will use those powers in a continuum, and we will avoid, where possible, making arrests. I hope the public will accept we're here to work with them and prevent offences. We're working with public health to try and give as much information as we can. But this isn't about trying to increase the arrest rate. This is trying to keep the population safe, and that is our key focus.
Thank you. What the level of fines available are. And can you also give us an update on how many officers you've got to deploy to try and police this situation, and what your rate of absenteeism is at the moment as well?
Okay, I don't have any detail with me of the fines. At the moment, law enforcement is in a good position. We do not have any significant abstractions from sickness, but like everyone across the community, we have people who are parents, people who are carers, and that has placed some abstraction. But as far as our day-to-day functionality, we are working well and there are no issues.
Mr. Hardy first.
Yep.
Are you looking to bring back into service any recently departed officers, or who is still anyone who's recently left the profession?
It is a possibility, and we are working in that, but nothing definitive has been put in place.
And for Dr. Brigg, regarding the contact tracing for the person who has prior community transmission, have you been able to map out who they've been in contact recently and trying to test those people as well?
So that's in process. So we do contact tracing back for the 24 hours prior to the person becoming symptomatic. So that's the first group that we've focused on. And that's important because those are individuals that are most likely to have been infected, and we want to make sure that we provide the appropriate care for them, but also we then provide the appropriate testing if required. But you're absolutely right. We've gone back 14 days from the time the person first developed symptoms, because that's the longest incubation period of COVID-19. And what we're doing now is we're trying to see if there's a link with any of our other known cases on the island, but also we're looking at the contacts of the known cases. So we've got a whole map out of the 23 positives we've got, the contacts of all of those positives, and we're cross-linking all of that. Now, as you can imagine, that's not a quick job, and it gives us information on the epidemiology, on the spread of the disease on the island. However, from our perspective, the most important message is that we have community transmission of the virus. So what triggered our decision today was nothing that happened in the UK yesterday. What triggered our decision today was what happened in Guernsey yesterday evening when we got the first case of community transmission. And that's been the basis of our action. It's local evidence to inform our decision making.
Okay, Heidi?
I think it's also important to understand here how much more rigorous public health have been here than they have been elsewhere, because they're going further back doing the contract tracing. So it's it's amazing how much work they have been doing through the weekend and right up to this moment in time, going further back in time to be able to trace contacts than would ordinarily be the case elsewhere. So we get a better picture and we know what's happening in the community.
Okay, so a question in the front.
Dr. Brink, is your mic working?
I think so.
You mentioned yesterday about shielding measures for the more elderly members of the population, or the more vulnerable members of the population. We haven't seen that information come out into the public domain yet.
So shielding specifically relates not to older members of the population, but specifically relates to people with certain clinical conditions. So that has gone to our clinical colleagues in primary care and the medical specialist group and in health and social care today, because we specifically wanted to make sure the categorization used in other jurisdictions was appropriate for us. So it's patients with leukemia, lymphoma, bone marrow transplants, patients on chemotherapy. It's poorly controlled asthmatics on high doses of steroids. So there's some very specific clinical indicators for that. So what we've done today is we've sent that out to our primary care colleagues, the medical specialist group. What we want to do is for our primary care colleagues to actually write to patients within their practices that fall into those groups. So in addition to some general messaging, we want to try and do some bespoke messaging as well. And that's all in hand at the moment. So our message to older people is a more generic message of social distancing, but for those that are particularly vulnerable in our community, it's one of extreme shielding, and that'll go, we'll be recommending that for longer.
Okay, in the middle.
We've mentioned Guernsey, lots of advice here in Guernsey, but our bailiwick is made up of multiple islands. Can I confirm that the advice or the measures that are imposed from midnight tonight apply identically to the other islands in the bailiwick, or are separate strategies being enforced elsewhere?
No, it's the same strategy, and of course the Civil Contingencies Authority is a bailiwick-wide authority. It does contain representatives of both of those other jurisdictions. Obviously, it was one of the considerations that needed to be taken into account is the relevance and application of the same set of rules, if you like. But again, having in conversation with the community there, but also, of course, taking account of public health's advice, also taking account of their own limited infrastructure and their own demographic. Again, notwithstanding that they have not got a community transmission case in either of those islands that we're aware of, nonetheless, it was still felt appropriate to be the right measure. But Heidi.
Yeah, and there are representatives from Alderney and Sark on the CCA, so they were part of the discussion and agreement to the regulations today.
Good.
You've highlighted a minimum, of 14 days. Is that the period that you're hoping to have on-island testing set up and starting to go?
So the incubation, the 0 to 14 days is the incubation period from infection to acquiring the virus. With regard to the testing, we don't want to put an absolute deadline on that, because we've got to get the final piece of kit. We've got to do the standardisation. We've got to make sure we can get it working locally. And whilst I'm strongly encouraging, I don't want to put people under too much pressure. We want to get it going properly so it runs well. So I don't want to give you a precise date for that, if you don't mind.
No. Matters have been expedited as fast as we possibly can, so hopefully we can get it in far faster than we were originally saying. But that's because of the fantastic effort that's been going on behind the scenes with so many people. Both at health and social care throughout the states of Guernsey, and all our colleagues and partners outside as well.
But the 14 days is quite clearly linked to the incubation period rather than the testing. Right at the back and then back to the middle.
I believe the release talks about discussions with supermarkets and measures that they may be bringing in. Have you got any indication of what measures supermarkets may be bringing in to cope with the restrictions, and especially in terms of food supplies and stocks?
Yeah, I mean, I'll deal with that briefly, and then perhaps ask the Chief Executive, Paul Whitfield, to come in as well. These measures do not affect the logistics chain and the resilience of that in itself. What they are really doing will be in terms of affecting the community's frequency and time in which they go to the shops, but the shops themselves will still be supplied to the same extent. But Paul, if you wouldn't mind addressing that point.
Yeah, I'd certainly add, and again to reinforce points made previously, our supply chain remains exceptionally strong to the island in terms of supplies and goods coming in. And again, just to reinforce that it's not a necessity to panic buy. We really would encourage the community to just get what they need, the necessity of what they need, particularly against the new strict measures that have been put in place. But indeed, a really fantastic response from the supermarkets into the measures they could put in place. Liaise very closely with key staff who worked with them from last weekend. And you'll have seen a lot of those practical arrangements already put in place about screening staff on the cashier's desk, putting sort of stand-back line marks in order to keep us all safe and keep encouraging that social distancing.
Okay.